It is Breast Cancer Awareness Month, and all month long we'll be sharing with you stories of survivors, those currently battling the disease, and important information you need to know concerning early detection. And while early detection is key to treating a cancer diagnosis, so is knowing your risk factors of developing the disease in the first place. That's why knowing your family history is so important. And for some, genetic testing could provide some insight. I spoke with a geneticist at Baylor Scott & White in Temple to learn more about who should take a test and what you should do with those results. The average woman has a 1 in 8 chance of developing breast cancer in her lifetime. But if you have a first-degree relative, that's a parent, sibling, or aunt who has breast cancer, especially if they had it at an early age, you're at a higher risk yourself and should talk to your doctor about genetic testing.
So genetic testing is to really better understand the genetic determinants or vulnerabilities that we all have to specific types of cancer.
Dr. Blazo, a geneticist at Baylor Scott & White, says genetic testing is relatively easy. Most tests use either a blood or a saliva sample.
So the laboratory will analyze as many genes as we want them to. The most common genetic causes for hereditary breast cancer are the BRCA genes, breast cancer 1 and breast cancer 2.
Your test could come back positive, negative, or VUS, variant of uncertain significance.
So a variant of uncertain significance. Rest assured, that laboratory has looked at all the data, but we don't have sufficient evidence at this time to say that that variant is disease-causing. And most of the time, they really are negative.
So what do you do with a positive test? Dr. Blazo says there are 3 approaches: increased monitoring, discuss medications called chemoprevention, or undergo risk-reducing surgical strategies. For example, you could get your breast tissue removed with a preventative mastectomy, much like Angelina Jolie did back in 2013, among other options. Because you share genes with family and can pass them down, Dr. Blazo says it's important to share your genetic testing results with family, regardless of the outcome.
And even if it's negative, it's important to share that information with our families because awareness is key.
And while there are companies out there that allow you to order one on your own, the recommendation is always to speak with a doctor or genetic counselor first.
But we want that testing to be done in the context of what are you going to do with that information.
So just so we are clear, testing positive for a variant doesn't mean you will automatically develop breast cancer, but you do have a much higher chance. And depending on your family history and insurance plan, a test could be covered by your insurance. But if it's not, Dr. Blazo says those tests typically cost between $250 and $350. Now, Jordan, you know, a lot of talk about breast cancer awareness is focused towards women, but these tests are also looking at your risk of prostate cancer for men and ovarian cancer for women as well. And these genes can be passed down, male or female.
Absolutely, and just raising awareness is the most important thing, and getting tested early too. You know, $200, $300 seems like a lot, but you know what? It could save your life. It could save, you know, all the trouble that happens within your family because of it.
Yeah, and I know a lot of people may not want to take the tests because, you know, they say ignorance is bliss, but that awareness is key.
Absolutely.
So that's what I would say to those of you who may be scared to take that test. And here on Texas Today, we are doing our part to help out. We would love for you to join us on our Walk to End Breast Cancer. It is on October 30th in Waco. Join our team. You can text the word Komen to 254-777-6000 to sign up or donate.